In this lecture, we'll try to understand the anatomical terms that are used to describe movements that are taking place at a joint. There are various movements taking place at a joint, and there are anatomical terms which are being used to describe those movements taking place at a joint. The movements at a joint are being caused by the contraction and relaxation of the muscles. Let's see which are those movements. So here we'll first discuss about the flexion and extension. These are the two terms that are used for describing increasing or decreasing the angle between two body parts at a joint. Here you can see the angle here at the knee is 180 degree, and decreasing the angle of the lower leg below the knee is called flexion, and increasing the angle of the at the joint is extension. Straightening is extension. Let's see. Flexion refers to the movement that decreases the angle between the body parts. Bending the body part at a joint is called flexion, and flexion at the elbow will decrease the angle between the upper arm and forearm, and flexion at the knee decreases the angle between the femur and the tibia. The bone here in the thigh is femur, and bone here in the lower leg below the knee includes tibia and fibula. So decreasing the angle between them, between the femur and tibia, between the thigh and the lower leg, is flexion. Extension, it refers to the movement that increases the angle between the two body parts. Here in the same case, the extension of the elbow will increase the angle between the upper arm and the lower arm, straightening the arm, making the arm straight. At the elbow is extension. Extension of the knee is straightening the lower limb. Lower limb is being straightened. Here you can see it is being straightened, is extension. Then abduction and adduction. Abduction and adduction are the terms used to describe movements towards or away from the midline of the body. Movement away from the body or movement towards the midline of the body. So let's see first. Abduction is the movement of a body part away from the midline of the body. Abduction, here you can see abduction. Here the arm is being moved away from the midline of the body. This is the midline of the body. Is being moved away from the body. Is being moved away from the body. Is abduction. For example, abduction at the shoulder joint raises the arm out to the sides of the body. Raising the arm out to the sides of the body is abduction. Then adduction, this is the movement of a body part towards the midline of the body, bringing it closer to the body. Bringing it closer to the body is adduction. Bringing it closer is adduction. Adduction of the hip joint brings the legs together. Bringing the legs together is adduction. Okay, whereas in fingers and toes, abduction refers to spreading, moving away the fingers. Moving away the finger is abduction, and bringing the fingers together is adduction. And adduction refers to bringing the fingers and the toes together. Here this is adduction, and here this is abduction. And let's next discuss the rotation. Rotation can occur in the vertebral column or at a pivot joint. Rotation of the neck or the body is twisting movement produced in the vertebral column. The twisting movement produced in the vertebral column causes the trunk to the body to rotate. At a pivot joint, One of the bone rotates in relation to another bone. Rotation is only the movement allowed at a pivot joint. You can see that here there is a pivot joint at the neck, the atlantoaxial joint between the first and the second cervical vertebra, and that is a pivot joint, atlantoaxial joint, which helps the head to rotate from side to side. For example, the atlantoaxial joint between the first cervical vertebra, atlas, and the second cervical vertebra, axis. The joint is formed between the atlas and the axis, atlantoaxial joint, which is a pivot joint which causes rotation. And this allows the head to rotate from side to side. And the proximal radioulnar joint, the joint between the proximal ends, the upper ends of the radius and ulna in the forearm, is a pivot joint, which is also helping in the rotation. And this joint allows the radius to rotate along its length, causing supination and pronation, bringing the palm of the hand, turning the palm of the hand from down to up is supination, and bringing the palm of the hand down is pronation. So this movement is possible only because pivot movement, rotation taking place at the proximal radioulnar joint. The next is medial rotation and lateral rotation. Medial and lateral rotation refers to the movement of the limbs along their long axis, inward or outward, turning it in or turning it out. Turning it in is medial rotation, and turning it out is lateral rotation. Let's see medial rotation. This is the rotational movement towards the midline, inward movement towards the midline of the body, and this is also called internal rotation. Here you can see that. So bringing it towards the body is medial rotation. Internal rotation, this rotation is taking place at the shoulder. Then as a straight leg rotated towards the midline of the body, inward movement, is an example for medial rotation of the hip. Here it is being brought in is medial rotation. The movement is taking place at the hip. And rotating the arm towards the midline of the body with an elbow at 90 degree is also an example for internal rotation. Here, this is an internal example for an internal rotation, here medial rotation. Then lateral rotation, this is rotating movement away from the midline of the body, and this is opposite in opposite direction to that of the medial rotation. Here you can see that. So taking it away from the midline of the body is lateral rotation. You can see that here in the hip joint. Moving it out is lateral rotation, external rotation. The next is supination and pronation. Turning the hand from a position of the palm facing down. The palm is facing down now and is being brought to a position where the palm is facing up, and that movement is called supination. Here, this is supination. The palm is made to face up, is supination, and turning it down is pronation. Turning the hand from a position of palm facing up to a position of palm facing down is pronation. Then dorsiflexion and plantar flexion. These are the terms used to describe movements at the ankle. And these are the two. There are two surfaces of the foot. The upper one is the dorsum. The upper part is the dorsum, and the lower one, the sole, is plantar surface. The sole of the foot is the plantar surface, dorsum and plantar surface. Here there are two movements, dorsiflexion. This refers to flexion at the ankle so that the foot points more superiorly, moving the foot upwards. Moving the foot upwards is dorsiflexion. And plantar flexion refers to uh, extension of the extension at the ankle, so that the foot points inferiorly, or moving the foot downwards. Moving the foot down is plantar flexion. Next is inversion and eversion. These are the movements occurring at the ankle joint. Again, they are occurring at the ankle joint. Inversion is the movement of the sole of the foot towards the median plane, towards the inner aspect of the body. Turning the sole of the foot in is inversion, and turning the sole of the foot out is eversion. Eversion is the movement of the sole away from the median plane. Then circumduction, this is a rotation of a limb, upper limb or a lower limb, or a part of a body forming the shape of a cone. Here you can see that in the diagram. So it forms the shape of a cone. It forms the shape of a cone is circumduction. This kind of movement is circumduction, sometimes described as circular motion, but it is conical due to the cone formed by moving the body part at the joint. A conical movement is circumduction, and what is its applied anatomy of learning the anatomical terms related to the movements of the body at the joint. Here, these knowledge about the terms of movement helps a healthcare professional to perform physical examination effectively, and it also helps the nurse or any healthcare professional to understand and explain the patient about the range of movement, the range of motion exercises. That is all about the movements and the anatomical terms used to describe these movements of the body. And thanks for watching.